Welcome at the sixth EcoHealth webinar series organized by the Institute of Tropical Medicine in Antwerp. We're happy to have you here. I hope that everybody hears and sees this introduction slide. My name is Remco van der Pas. I'm a Senior Research Fellow in the Health Policy Unit at the Department of Public Health in Antwerp. Together with my colleague Sarah van Belle, also from the Health Policy Unit, we are moderating today's session. The EcoHealth group in Antwerp is an interdisciplinary group looking to the intersection of animal, human and ecological health, and we realize that to tackle these challenges in current times, we very much need an interdisciplinary perspective. We do this, of course, from a from an health and a public health angle, understanding that we also need to look at pathogens and at diseases, but at the same time getting a better understanding about how ecology and social patterns work. This is the sixth in a series. It's mainly a way of getting to know and to have a dialogue with other disciplines and get different perspectives. So I'm very happy that today we have Stijn Oosterling here, who is a professor in urban sociology at the University of Antwerp. His details can be found online, so I will not go into details there, but he looks very much into urban sociology and bottom-up initiatives and how solidarity is organized, including in new communities and in how migrant communities integrate themselves into cities. The title of his talk is Exploring Alternatives to Neo-Assimilationism, Looking for Solidarity in Diversity Here and Now. It's a place and practice-based perspective on solidarity within the city and how we have to deal with super diversity. It will raise a lot of questions, I hope. Sarah van Belle will moderate that. I'm very much looking forward, and thanks Stijn for taking the time to be with us. And without further ado, I give the floor to you, Stijn. You will speak for about 20-30 minutes, and then we will have a discussion. Over to you.
Good afternoon. My name is Stijn Oosterling. I'm an urban sociologist at the University of Antwerp, and thank you very much for inviting me to the Institute for Tropical Medicine. I don't really receive that many invitations to talk to medical scientists, so I'm really happy that I can do this today. Okay, so I'm not directly working on issues of health, although I do have a lot of interest in local social innovation, which is really the kind of bottom-up social initiatives to address societal challenges in mainly multi-ethnic and disadvantaged neighborhoods. And in that context, we of course often come across health initiatives such as neighborhood healthcare centers. The Wijkgezondheidscentra is one issue that we have been looking into for some time. But the presentation that I have today that I was asked to give is dealing with another issue, which is the issue of solidarity. And I think especially in times of the current pandemic, we are all too aware of the importance of solidarity, especially when society is under strain, is confronted with big challenges. Solidarity is an important issue. And what is even more important, especially in our current cities, not just in Western cities, but in cities all around the world, is the issue of diversity. And one of the big questions that social scientists, especially sociologists, are asking themselves for the last decades is how can you organize solidarity in societies which are really diverse in ethnic and cultural terms? So how do you combine a diverse population with the issue of with the generation or the production of solidarity? And I will explain in detail what I mean with solidarity and why we think that diversity and solidarity are not that easy to combine. So let's move on to So the basic framework of the research project, this is based on several projects, amongst which a project on governing urban diversity, which was a European framework program on diversities, but also a project which was subsidized by the a strategic basic research project, which was looking at solidarity and diversity. So I will combine insights from these two projects. Now, in the framework of the diversities projects, we were looking at diversities policies. So we were looking at in 12 different cities around Europe. We were looking at how cities were trying to deal with diversity, with ethnically and culturally diverse populations. And we did so in 13 or 14 different cities. And what we noticed is that the conventional approach of dealing with diversity in cities, which is the multicultural approach, was increasingly dropped. And the multicultural approach, that's a very long discussion, but let me just explain what it basically means. It basically means that you as policymakers kind of accept that you have different ethnic and cultural groups in your society, and that you try to support ethnic and cultural minorities to organize themselves in self-organizations and to defend and articulate their interests towards the city council and towards the broader society. So it basically means that you have a special policy which is directed at ethnic and cultural minorities as a group, yeah? And then everybody who has a particular ethnic and cultural background is then assumed to be part of that group, and that you have them organized, that you support the way they are organized themselves. And then, of course, you have ethnic and for example, an advisory council on ethnic and cultural minorities. You support self-organization. You have something like Minderhedenforum in Flanders, who defends the interests of ethnic and cultural minorities. So this approach, we noticed, is increasingly dropped in many European countries, in many Western countries, and we see a kind of return to what we call an assimilationist agenda. Now, it's a pretty heavy term, and it basically means, and that's very important to understand for how our societies and how our governments respond to diversity. The basic idea of an assimilation agenda is that it is impossible to live together, to create a society, if you have too much diversity, ethnic and cultural diversity. And so the idea behind an assimilationist agenda is that you should reduce the ethnic and cultural diversity within the population in order to organize, in order to let society function. And so then we have all kinds of debates, for example, about visible signs of religion. The headscarf, for example, is one of the prime examples, speaking a different language, having specific culture festivals, and so on. So we see in many European countries a return to an assimilationist agenda because there is an increasing belief that you can only organize societies if you sort of reduce at least the visible signs of diversity. That is mainly the case on the national scale, national governments. That is less the scale on the city government level, because of course the diversity there is much larger. But also on the urban scale, you see a kind of attempt to go back to an assimilationist agenda. And that is certainly the case in Antwerp. Antwerp has in fact has always had an established assimilationist agenda, and that of course has to do with the very strong presence of the extreme right in this city. And so I think the previous alderman, which was responsible for diversity, very clearly and also explicitly said that his agenda is an assimilationist agenda. So an agenda which doesn't believe that you can actually live together in diversity, that you should actually reduce diversity to be able to organize your society. At the same time, you see, if you look at how cities operate, if you see how civil society organizations organize themselves, if you see how private entrepreneurs function, you see that on the local level, despite this tendency towards a more assimilation agenda, you see all kinds of different initiatives who follow different approaches, who are more positive about diversity and who don't necessarily believe that it's impossible to live together in diversity. And so most of the small initiatives in cities that address diversity reflect actually a more positive approach to diversity. And so what we were trying to do in our research projects is to try to explore alternative to this assimilationist approach, because we actually feel that the approach to diversity is too negative, is too septic, and that in fact is not exploring sufficiently the possibility of organizing solidarity in diversity. So the starting point for analysis is a couple of sociological findings in which for a lot of people, and you see a couple of examples here, Robert Putnam, Ruud Koopmans, and others have been actually raising the issue that in fact solidarity in established welfare states, and established welfare states have an historically unprecedented level of solidarity. I think that's really important to say, that our societies do not lack solidarity. If you see what is redistributed in the welfare state, these levels of redistribution, which in Belgium are over 1/3 of the added value which is every year produced, that's a historically unprecedented level of solidarity which is organized there. Well, many sociologists have been raising concerns that in fact it seems like these kind of very high levels of solidarity in established welfare states, in formal terms through welfare state provisioning, but also in informal terms, people helping each other, that they are challenged by increasing ethnic and cultural diversity. That in fact, many people in our societies do not believe that these high levels of solidarity can function equally well in ethnically and culturally diverse society. Now, what do we mean with solidarity? It's a term which is often used, and it's not so easy to define this term. We refer to solidarity. For us is about sharing resources. It's about the willingness to share resources. In the first instance, money through unemployment benefits, retirement benefits, and so on. But it could be time. You could also share time. You could of course help. For example, you can help the kids from your neighboring family to make their homework. That is also solidarity. You share time, you share a resource with these people. So solidarity for us is about sharing of material and immaterial resources, money, time, attention, space, out of the idea that there is some kind of loyalty to a group. So the idea is you share resources and you share that with members of a group to which you have a certain loyalty. And this loyalty is often based in the idea that your fate is shared with each other. So, for example, if you look at the solidarity which is asked from us, very often medical experts have been saying you should live up to the rules, the COVID-19 rules, because that's the way you show solidarity to the other people. And they're trying to explain to us that, in fact, if we don't live up the rules, then the fate of the group which we are part is as a whole in danger. That in fact we all should be in solidarity. We should all live up to the rules. Otherwise, the whole group of which we are part will be in danger. And so that's a clear sign of solidarity. The fact that you share resources, but you do that out of a sort of loyalty to the group, because otherwise the group might be in danger. Now, the question in our research projects, and we've been working on that for the past 10 years, is the question if how can you have forms of solidarity which also work in ethnically and culturally diverse circumstances? Because apparently, as many sociologists have pointed out, for many people solidarity is something which is easy to organize in your own culture group, but becomes more difficult if you have to organize it across ethnic and culture boundaries with members of other ethnic and cultural groups. And so what we have been trying to do in many of these research projects is trying to understand how is it possible to be in solidarity with people with another ethnic and culture background. And we think this is of course very necessary given the high diversity in our society. I mean, we at least, if you look at Flanders, for example, at least 1 in 5 has a different ethnic and culture background, has a migration background. If you look at Antwerp, for example, more than one in 2 has a background in a different ethnic and culture community. So that's a very urgent question. Now, this is an attempt to summarize sociology on just one slide, which of course is bound to fail. But what we've been trying to do here is that sociology is this discipline of solidarity. There is no concept of no notion which is more central to sociology than the notion of solidarity. So the basic question of solidarity has always been, how is it possible, given the scarcity of resources? There is not enough for everybody's desires. Maybe there is enough for everybody's needs, but there is not enough for everybody's desire in terms of material resources, space, and so on. So if you have this scarcity of resources, how at all is it possible to live together in a relatively orderly manner without having fights and conflicts all of the time? And the basic answer to that from sociology is this is possible because solidarity exists, because there is something that triggers people, that stimulates people to be able to share resources with each other. And because we are willing to share resources with each other, we can live together in a pretty orderly way. And then, of course, the big question is, what generates this solidarity? Why do we have solidarity in this society? And in fact, sociology came about as an attempt to answer this question, because before the modern period, before the Enlightenment, the answer was easy: religion. We all believed in the same religion, and religion asked us to act in a particular way, also in solidarity, and that was the way society was kept together. But once religion disappears as the glue that keeps society together, the basic question then is, what is religion replaced with? And basically in sociology, you can find 4 different answers to that. And the question then is whether these answers, whether these sources of solidarity, these roots of solidarity, are still valid today. I won't go to the whole table, but I will just sort of briefly summarize each of these 4 sources. The first one is interdependence. We are a society in which everybody is specialized in a particular task. We are not all peasants cultivating the land, growing a little bit of cattle, and being self-sufficient. That's not how we live. We are interdependent. We all are specialized in a specific task, in a specific job, and we receive money, which we can then use to purchase everything else what we need to lead a life. And the awareness of that, if I give this lecture today, I can only do so because there are teachers that are looking after my children. There is somebody preparing food. There is other people preparing the chair making chairs in which I sit, making sure the internet works. And so the awareness that we are interdependent, that we are all dependent on each other, that exactly is this awareness exactly what stimulates solidarity. Because I know, even though I don't see all these people, and even though we do different things, I'm actually dependent on them. So I should be in solidarity if something bad happens to them. So this interdependence is a very important source of solidarity. Secondly, one of the other sources of solidarity is the fact that we share norms and values. At least that's the assumption, and that is not always the case. But one of the other sources of solidarity is the sharing of norms and values, having a similar outlook on life. And these norms and values are not religious this time, or they're not necessarily religious. They are something that comes out of our history, and that we think we share with each other. And because we share this, we are a community of norms and value. We are a moral community, and therefore we are able to be in solidarity with one another. And of course, the formation of nations in the 19th or 20th century has been very powerful source of this kind of moral solidarity. A third sort of solidarity is struggle. The labor class movement, for example, has been very instrumental in creating welfare states. They have been fighting for solidarity from the rich to the poor. And in fact, by doing so, by having a shared enemy, that's a very important source of solidarity. If you have a shared enemy, and that may be another group in society, but it may also be a virus. And remember the very spontaneous emergence of solidarity in the beginning of the emergence of COVID-19. It was almost spontaneous because we all had a shared enemy, the virus, and we were fighting together. So that created kind of a coming together. And so struggling against a shared enemy is also a very important source of solidarity. And then the last source of solidarity is a little bit more on the micro level, which means the level of the direct interaction between people, and that's encounter. One of the ways in which we try to have solidarity with each other is by having informal interactions with each other. We meet each other, and by meeting each other, we learn a little bit more about who we are, and we create a little bit more empathy for each other's situation. And through this empathy, through understanding other people's life, we actually create a kind of connection and a kind of solidarity with one another. And that's something which has been very popular. That's in fact also a little bit the multicultural model, and you create encounters between different people, between members of different groups. And by learning about each other's life, we grow empathy, and this empathy is then the basis of solidarity. Now, I know this is pretty abstract and a pretty schematic overview of how we think about solidarity and solidarity. So let's try to bring it a little bit more to the actual situation in which our society is now. If we look at these sources, our argument is, or our finding is, that these sources of solidarity are still with us today. These 4 different ways of creating solidarity are still very visible in the way we try to organize solidarity. And I show you we have a social insurance system, which is basically the collective pooling of risks. So it's organizing interdependency in a particular way of solidarity. We are trying to create shared norms and values to nation state formation and to civic education. We have solidarity because people struggle for redistribution, for example, and we organize encounter between groups. So we do create solidarity in this particular way. Now, the question then is, why is this so difficult in ethnically and culturally diverse society? And the reason why, according to us, is because we have learned a great deal about how to be in solidarity with each other over the past 100 to 150 years. And that's why we have historically unprecedented levels of solidarity on a massive scale, not just on the local level, not just between neighbors, but on a really massive scale in nation states and even beyond nation states. I mean, we have a sort of common program to buy vaccines, which also, is based on some form of solidarity. So we organize solidarity on a massive scale, but we do seem to have difficulties or encounter difficulties of doing that in ethnically and culturally diverse societies. And the reason for that, according to us, according to our research, is because we have actually never learned to be in solidarity in diversity. We have actually learned the opposite. We have learned to be in solidarity amongst culturally homogeneous groups, because the construction of the welfare state, the construction of this very elaborate forms of solidarity happened at the same time that we were creating nation states, national states. So we've learned to organize solidarity on the national level, in culture, at least in our assumption, culturally homogeneous national states. And because we have done so, we're pretty good at organizing solidarity, but we're good at organizing solidarity in culturally homogeneous groups. We're not good at organizing solidarity in ethnically and culturally diverse societies, because we've actually never learned to do so. And the argument here is that we have actually, in the 19th and 20th century, we have nationalized solidarity. We have learned to create solidarity on the national level. We have built welfare states, but we have interwoven them with the creation of national states, which means we have a social insurance system, which is we bring together the risks of groups active in many different professions, and we create a social insurance system between them. So we use their independence, but we do that on the national level. It only extends to the people who are present in Belgium or France or Germany and so ever. We've done so by putting up a struggle for social rights, a struggle which is still ongoing today, a struggle which has been successful, at least for the people from the same culturally the same culture community, the same nation, but which has been less successful, I think, in extending it to other groups. And it's not easy, it's not difficult to see that. If you see the level of solidarity within the social security system, and you compare that with the levels of solidarity through development aid, then you see the difference. I mean, 1/3 of our added value which is produced in our country is redistributed. And if you then see the decade-long attempts to at least have a solidarity with 0.7%, I think, of the budget, of the national budget, would be allocated to development aid, which is not reached by many countries, then you see the difference. So we have been struggling for solidarity, we've been successful for that, but only on the national scale, not beyond that. And most importantly, we have done so on the basis of cultural homogenization within territorial nation states. It extends to the people who are present here, who are member of the Belgian society. It does not extend to people outside of that. And that's important to understand. We have been able to organize high levels of solidarity, but they are organized on the assumption that we do that with people who are like us. And then it's, of course, not difficult to understand that in times of migration, in time of increasing diversity, in times of, in these kind of contexts, solidarity doesn't function as well. And so if you then look at the classical source of solidarity, you can see how migration and diversity disrupts these kind of sources of solidarity. Norms and values, for example, are no longer shared, if they ever were shared. But at least there was the idea in the nation state that we shared norms and values. And the reason why we shared them is because we transferred them from generation to generation. It is through the socialization of children in the family. It is through education that we learn about the norms and values of the society which we live in. Now, this historical continuity is disrupted, of course, if you have large amounts of people moving across boundaries. Not everybody has been raised here. Not everybody went through the education system. Not everybody has the same cultural reference points. And that creates confusion about the actual norms and values which govern our society. So the intergenerational transfer of culture frameworks of norms and values is disrupted. The interdependence is also no longer functioning as a good source of solidarity. And the reason for that is that we see an overrepresentation of ethnic and cultural minorities in unemployment. And in employment, of course, if we organize solidarity mainly through transfer of resources of people who are working to people who are, for whatever reason, not working, through unemployment benefits, through retirement, through child benefits, and so on. If not every group is perceived to be contributing to the same extent, for whatever reason, that of course disrupt the idea that we're interdependent. And so many people say, if you do surveys, many people say, why would we be in solidarity with people with a migration background if so many of them are not working and are not contributing? And so whether that's true or not doesn't really matter at this point. The effect is the same. If the perception exists that not everybody is contributing to the same extent, then the idea of interdependence is no longer working as a proper source of solidarity. At the same time, struggles have also become a more difficult source of solidarity, because in fact, and that's what we call the progressive's dilemma in social struggle, in the beginning, in the decades running up to the welfare state, the struggles were pretty easy. It was about economic redistribution from the rich to the big mass of people who were poor, who had a low paid job. And that was not an easy struggle, but at least there was a kind of idea that the people who were struggling for redistribution were more or less the same people. Today, of course, these kind of struggles are much more complex, because there's also the struggle between the feminist movement, who says, yes, but men and women, even if they're from the labor class, are not equal, they have different interests. Or the anti-racist struggle, who says, yes, but not everybody is migrants, or migrant laborers are different from white laborers, and so on. So the struggle is kind of made more complex. And because the struggle is made more complex by other issues being put on the agenda, in fact, it becomes more difficult to have it as a source of solidarity. And because the trade union may be criticized by the feminist movement or by the anti-racist movement. So in fact, the struggles become more divisive rather than bringing people together. Now, and it's in this context that we've been trying to find out, if it is so difficult to create solidarity and diversity, what can we do to generate that? And so the basic answer of society, as I already explained, is cultural assimilation. Reduce the amount of diversity in society, for example, by saying it's no longer allowed to wear a headscarf in education system, or you should keep your religion in your private sphere, not in the public sphere, and so on. So reduce diversity. Now, from the point of view of cities, this is a non-option. I mean, this is impossible, because most cities have become what we call minority-majority cities, by which we basically means there is no longer, at least not in demographic terms, there is no longer a culture majority. In fact, the majority of the people are the minorities. And the ones that were previously the majority, and in our cities, this is the white groups, they have become a minority, maybe a big minority, but still a minority. So in these kind of circumstances, if we reduce diversity to end up with a sort of culturally homogeneous group, the question then is who would be this, what kind of culture framework would that be? Because there is no longer a majority. So culture assimilation is a non-go option. This can only be incredibly exclusionary. You can only do so by using quite repressive techniques, by imposing a particular framework, and by using the power to basically impose a culture framework. And it can only be exclusionary. So that's not really an option that is really pursued in the literature. Secondly, you have the work of Robert Putnam, who's one of the big scholars in this field, and he says, well, he's from America, and he says we've been doing that before. The US is a nation which is constructed out of many different nationalities, and over the course of many decades, we have become the American people, which is a melting pot. It's not just one ethnic and culture group; it's a diversity of culture groups. So we should actually create a new we. Out of many other diverse communities, we should construct a new we. And so he basically says, over the course of many generations, we will succeed in that. And this is a reasonable option. And it has shown to be the case, not just in the US, but in other countries, you could see that as well. But it takes a long time. It's a long-term solution. Because you actually recreate the kind of historical continuity on which nation states are based in Europe. So it takes too long. I mean, what are we supposed to do in the meantime when we're living in these very diverse circumstances? And so it's in this context, and I'll come to the core of the argument. It's in this context that we've been trying to look if we want to organize solidarity and diversity on the short and medium term, what is there to build upon? And there we say, in fact, we should look again at what we share. If we don't share a kind of history with each other, if we don't share similar norms and values, what do we share in our cities that are so diverse? And there, the answer which we have been pursuing is we actually share the places which we live together. Whether we want it or not, in cities, we share public spaces with lots of different people. If you go to the workplace, especially the lower skilled parts of the job, but also universities, whether we want it or not, we meet people with very diverse culture backgrounds. If we send our children to school, whether we want it or not, especially in cities, we will meet people with many different culture backgrounds. If you go to medical practice, whether it's a dentist or a general practitioner, and you're in the waiting room, you are together with people with many different culture backgrounds, whether you want it or not. So let's say, okay, we share the space, whether we want it or not. Let's make the best out of it. Let's try to take joint responsibility for the places we share, and let's make this the basis for sort of reinventing our society, reinventing solidarity. And let's do this by doing things together. Let's not have elaborate debates. Well, we can have these kind of debates, but they will not immediately lead to a conclusion. We can have long discussions about the compatibility of Islam, for example, with the Enlightenment values. And we have had this discussion for a very long time, and they probably will continue for a long time. But that takes a long time, so we can't wait for that. So let's sort of take some distance as well from these kind of long-term debates on the national level about what is our culture, what are the norms and values that we share. But let's focus on what we do here, what we do concretely in these public spaces, in this waiting room, in the doctors. What happens when a doctor is confronted with the diversity of medical patients and patients who don't always share the kind of science-based advice that they share. So what do we do in these places? Let's focus on the places that we share and the practice that we engage in together, what we actually do in these places. And then so that's the focus that we've been trying today, and we do this together with a lot of organizations. So we've been developing this research with close to 50 organizations who recognize what we're doing and who say, well, this focus on shared places, on doing things together is actually what we also do in our joint practice. And I'm not sure how much time I have left, but let me just take one example. I'll have a couple of examples. Let's take this one, which is maybe closest to the medical practice that most of you will probably be involved in. So let me take a couple of minutes to develop that example. This is a school in Leuven. It's another municipality close to Brussels in Belgium. And this school used to be pretty close to the university hospital. It's a Mater Dei school. And so if you would go there 10 to 15, 20 years ago, much of the children in the school would be of a white middle class, even upper class background. You would have many people working in the hospital who would drop off their children at that school. And so the school was a pretty well performing school. Many of their students went on to do university and so on. So it was a school which was pretty proud with what it was doing. And then 10 years ago, more or less 10 years ago, the population of the neighborhood around the school changed rather drastically in a short period of time. Many people with a migration background, especially many asylum seekers, would live in this neighborhood. And the population changed from a white population to a population which was very diverse in ethnic and cultural terms, but also a population which was in economic terms much less well off. So many more people with a rather poor socioeconomic background. And so the initial response of the school staff, which in fact, I mean, we see this school as a kind of community in which there is a lot of solidarity between the pupils and the teachers and so on, and they form a kind of community. That community was unraveling. And the reason for that is because, in fact, much of the teachers were disappointed They said, well, we used to have this high level performing students, and now we don't meet our usual performance criteria anymore. And we don't really recognize the people who are in our room anymore, in our school rooms anymore. I mean, these are people with a very different background of the white middle class professionals who are teaching. So there is a kind of disconnection existing. And the initial response was very is something that we recognize in many different organizations that are confronted with diversity. Initially, people go back to history, to the norms and the values and the reference points who come out of that history and say, we used to be a good, well-performing school, and see now we are just declining. And that, of course, didn't work because it actually undermined the solidarity and the good operation of the school. And things in this school only started to change when a new director was appointed. A director that came out of this, that came from outside the school, and who basically said, I don't know the history of that school, so I don't have any historical reference point. I just look at who's present here in these classrooms today. I look at the parents who sent their children to this school, and it's with these parents and with these children that we have to organize educational activities. So I don't any longer look at the history of this specific place. I don't try to live up to some history of the past, which of course is very often also romanticized. I'll just try to organize it with the people here. And I try to get my team oriented towards the place that we share today with the people that are here today, and not with some sort of imagined past. And so he said, we need to reconnect the school to the neighborhood. We have to reconnect to the population who's sending their children to this school here. And this is not the population of the white middle class professionals who are working here. It's a different community. And so he did all kind of little changes. It's not revolutionary. So it's not like big changes, but for example, every morning he would be at the school gate. He wants to say, I want to see the parents who sent their children to school here. I want to have little chats with them. I want to sort of connect to them. And he was also asking his teachers and say, if you have a meeting in school and afterwards you're going to have a drink in the neighborhood, you go to a neighborhood pub where the people are who sent their children to the school here. Because very often these teachers would go to another place out of the neighborhood because it wouldn't be the kind of pubs they would normally go to. Yeah. He also made contact with all kind of small organizations in the neighborhood, and there turned out to be a sort of anti-poverty organization in the neighborhood who actually took care of a lot of the pupils after school time and gave them homework classes and so on. And they didn't know about that before. So they established connection with the local people. And they also said, what we do here in school must be relevant to this new population. So they also changed the curricula. Not in a major way, but for example, as you can see on some of the pictures here, some of the things they do in the morning is to have a sort of round and everybody brings in their experiences. And they said, let's sort of stimulate all these children with many different backgrounds to bring in their experiences, which means it doesn't have to be Flemish. If there is a child from the Philippines and there has been an earthquake in the Philippines, that mostly doesn't matter that much for people in Flanders because it's so far away from here. But if that child from the Philippines is here, there is actually a connection between this class and the Philippines. And that little girl that has family connections there is that connection. So it becomes relevant in this classroom. Not just the history of Flanders as a place, but the connections which are established today by this diverse group, that makes it relevant. So let's show to this diverse school population that whatever their experiences come from, they're relevant in this classroom. They're part of the kind of place that we're trying to create here. And this was actually pretty successful because, and that's where I'm going to finish. So if you just give me one more minute to finish off the presentation, then we can go to the question round. Initially, the school was really concerned to portray themselves as a diverse school. So we were trying to say, well, we see that you have actually developed over the course of time a lot of different ways of addressing diversity and reestablishing solidarity in that school population. Why don't you just present yourself like that to the outside world? And said, no, we can't do that because if we do so, we would lose the small amount of white middle class children who are still in the school. So we can't do that. It's too sensitive. We will be seen as a concentration school and so on. So it will give us a bad image. So didn't want to portray themselves to the outside world like that. And then we're talking about quite a few years ago, then the M decree came around, and the M decree for the Dutch-speaking people in the room, basically is a decree which is now again under discussion, in which the government decided that the regular school system should make much more attempts to integrate people with special needs, people with a specific handicap, people with autism, and so on, to integrate them in the regular school system. And of course, every school had to think about, how do we do this? How can we integrate children with, for example, attention deficit, ADHD. I can't remember the full name of that, but people who are hyperactive, how can we integrate them in a normal classroom? How do we allow this to have these children in the classroom? And the school actually found out that because they have been working with diversity for such a long time, there was no need for them to change everything, because they were already working for a very diverse school population, and they didn't have to take any special measures to, accommodate for people from the to have these kind of children integrated in the school. And so that, to us, was we took that in our ongoing conversation based on research with this education establishment. We said, this is why you should actually present yourself as a diverse school, because you have an advantage. You've been learning how to do this and to work with a very diverse school population. So you should be proud of that, and you should say you actually have some advantages over, let's say, schools which mainly work with white middle class people. You have actually advantage, and you should be proud of that. You shouldn't sort of hide out and hide away for that. You should actually ask more support for that, because you are further advanced than many other schools in addressing diversity. Okay, that's where I'm going to stop. I hope this was interesting to you. So I'm very much looking forward to answer your question. I have more examples, but I would sort of keep it for a discussion, and then we can maybe come back to other examples. Thank you for your interest, and I'm looking forward to your question.
Thank you very much, Professor Oosterlink. I think this was a very clear presentation linking our big sociology concepts to local and actual practices. I'm going to, here I am. Somebody else had to show my video. I have like 6 questions, but I will leave it first to the audience to see whether there are questions. So anyone who wants to start off? There are 2 questions maybe on the Q&A. So the first one, could you discuss the link between super diversity, solidarity, and urban governance arrangements? I think that is a very general question, and maybe for a big lecture. And I'm going to ask also the second question. Could we use health as a shared experience? This is from Wouter Arazola de Oñate. Now that everyone has been made aware of the importance of it due to COVID-19, complemented with health-centered policy making with the broadest definition of health, not just the absence of disease, but a state of complete physical, mental, and social well-being. I'm working on a book about it. So these are quite big questions. So I'm gonna bring it down a bit, I think, to 2 different levels, if I may, in the sense that I think there are let's say first, because Wouter is discussing Antwerp as well, I think. So maybe let's start with the open goal, Antwerp and COVID-19, and the reaction of the authorities, sometimes being quite at a loss how to deal with super diversity. Also experts commenting in a very, how do you say it, clumsy way about multiculturalism, shisha water pipes, and so on. How do you see, you saw also a lot of bottom-up local practice and the city authorities not linking up to it. Can you a bit give your view on that opening?
Yeah. I will first try to answer Wouter's broader question. Thank you, Wouter, for the question. This is not research I discussed in this framework here, but we did research on the neighborhood health care centers, and I think that's a big model of solidarity. So I'm very much in favor of these healthcare center, not necessarily because of the sort of health effects it has, because that's not really my domain, so I don't have much to say on that. But I think it makes our health system a system with a higher level of solidarity, and the reason is because they have a holistic model of healthcare, which I think brings in the neighborhood and brings in the broader context in which people live. If you look at, and that's typical for the welfare state, in fact, the welfare state and its tradition of social rights has actually been individualizing a lot of risks. And so people go to a general practitioner and it's a one-to-one relationship with that doctor. And it's an individual affair. And I think what we like about healthcare centers and the kind of and the way I think they organize broader solidarity is that not just the way they work with a third payer system, in which people have free access if they link themselves to the healthcare center, and then the costs of the wages of the people working there are then paid for by the healthcare system, but also because they actually link the healthcare situation of individual people with the collective condition in which people live. If people have, for example, problems with all kind of lung diseases like asthma and so on, they link it to the housing condition in the neighborhood. If they see lots of people with dental problems, they link it with the lack of accessibility to dental services of many children in the neighborhood. So they say, let's maybe we can organize a kind of mobile dental service. They link it to the stress of having to survive on very low means in the neighborhood. So I think what I like about these kind of healthcare systems, neighborhood healthcare centers, but also other kind of systems which you can organize on the neighborhood level, is that they see the collective conditions which are necessary for us to be healthy citizens. And I think that's important. That's a way of bringing solidarity in a new way, looking at the neighborhood. And in my impression, the COVID-19 situation, especially, and I know Wouter is also working on that, sort of contact tracing and the level of local experience and local expertise you need to do COVID contact tracing well, again, points to the fact that, in fact, this is the healthcare system should be organized on a sort of more collective grounds on the neighborhood level to kind of make us more resilient in the face of these kind of pandemics. And also organizing on a local level allows you to sort of bridge the gap between physical health and mental health as well, which again is a point which probably raised by the COVID-19 situation as well. I mean, if you have lots of older people in the neighborhood who may be lonely, who don't have a lot of people around themselves, what we often witness in our research, and I'm not a medical specialist, I'm just talking about what we hear in interviews with people in these kind of neighborhoods. It turns out that they don't have many people around them who can help them interpret certain certain problems they have with their bodies, for example. Before somebody goes to the doctor, of course, they have to interpret what's happening to them in terms of medical problem. And it turns out that especially older people with health problems, they often don't have many people around to share their doubts with, which often leads them not contacting a doctor when actually they should actually contact a doctor. And what this shows is that, in fact, there is this very strong link between social cohesion, between people having a network in the neighborhood, a network that also links to these sort of neighborhood healthcare centers that can bring people to, that can make connections between people in individual situations and their healthcare needs. So that would be my maybe long-winding answer to the question of Wouter. And that, of course, that also means that we see the neighborhood as a kind of shared space where we get together for our health and the health of our population, and not something that is brought down on the individual level where people just have to take their own responsibility and going to a general practitioner if they want to. So that's why, from a sociological point of view, these neighborhood healthcare centers are really a model in terms of the level of solidarity organized on the local level is pretty powerful, we think.
Yeah, I have another question in terms of, and I think it's a very important remark in the sense that, because then we jump to the low and middle income countries, for example, is that we are trying now also to promote universal health coverage at the national level in low and middle income countries, sometimes in very fragile and highly fragmented societies, like Haiti has a law now on UHC, Benin has a law on UHC. While that solidarity, as you say, is based on the nation state, isn't there, because it's ethically it's different, it's divided. And linking to what Xavier de Bethune says in his chat, he's saying solidarity is very high inside those cultural ethnic groups here in Antwerp, for example, with their constituency in the country of origin. So the solidarity is organized across borders. They're sending remittances to those countries. because their national solidarity level is probably not high. And are we then not overstretching their capacities if we ask them to be solid, to have a solidarity here too, in terms of that mixed neighborhood? So there is this networked solidarity with the country of origin. And I think that is an important remark.
Yes, it's important. I think this is the way we look at this diversity. The multicultural perspective looks at these people as separate ethnic and culture groups who, of course, have then a high level of internal solidarity because they recognize themselves as sort of being a group within a bigger society. And of course, they maintain connections with the country of origin, and which these connections are also a connection through which solidarity is organized with the country of origin. I think that is still there. I mean, there is no way you can deny that there are groups that tend to organize themselves as ethnic and culture communities. At the same time, this doesn't capture at all the dynamics in our super diverse cities. And so the term super diversity, which is a clear critique on the idea that you can think about the society today as a society which consists of ethnic and culture communities. There are clearly attempts, especially among people who are pretty new in our society, to organize themselves as ethnic and culture community, to create self-organizations, to organize solidarity amongst themselves. But we have had at least 50 years of mass migration in this country, and the Moroccan community does not exist. There are Moroccan communities in Antwerp, for example, but the Moroccan community does not exist because in the meantime, you have third generation, second generation, fourth generation. You have highly educated young Moroccan people in Antwerp. You have people who elderly people who just came here because they have family here. So these communities are so internally diverse that they actually are not really a community. And in these kind of circumstances, these kind of super diverse circumstances, it's really no longer possible to organize everything as is directed to ethnic and culture minorities and communities. That was the diversity policy, the multicultural diversity policies that many cities have. I think there's still a place for that. I think there is still a place for ethnic and cultural self-organizations, especially for newcomers. But this will not be enough. This will not be sufficient. This will not capture the kind of dynamics in our cities. And so in that sense, I think what is important, and that I think links back to your first question, Sarah, I think what is really important in terms of urban governance, not just if it's about pandemics, but certainly also about pandemics, is that you can, and that's for example, the difference which you will see between Antwerp and Mechelen, for example. They have a very different model of dealing with diversity. Bart de Wever is a nationalist, so when he thinks about community and who's part of the community, he thinks about the history. He thinks about the long-term continuity of people who are living here. And the way he talks about that, he tends to talk about people that have to integrate in an already existing community. If you look at Mechelen, for example, Bart Somers, when he was still mayor, had said, look, wherever we come from, and that's a typical liberal reflection, wherever we come from, let's not talk about the history, which we do not share, and we will never share that history. That's literally impossible if people move across boundaries. But what we share is a future. We live in this place together. We live here. We have a present and a future together. So let's think about the things we are doing today and what we will do together in the future, and let's unite around that. And I think that's a model which is much more attuned to the super diverse reality. Yes. So to answer very concretely the question, I do think you will have culture differentiated communication to some extent, but that will not be enough because many people do not recognize themselves anymore, especially second and third generation are not really that focused on ethnic and culture self-organizations. They feel themselves part of a kind of super diverse city. So I think it's really important for mayors and and that's also what we find in research. It's really important that they talk about the present that we share and the future that we share. So what we share is a city which we live in today, not a shared history, because the history is only today is only a source of division. I mean, look at the whole debate about colonial status and so on. The history divides in our super diverse society. So let's talk about a common future, and let's talk about the city that we share. And I think if you communicate in that way, you probably communicate much more inclusively than if you focus much more on ethnic and culture minorities, and if you problematize ethnic and culture minorities as if they are sub-communities who are not hearing the same messages.
I want to also, because we're running almost out of time, and there is another remark, but I just wanted also to transpose it very quickly to global cities and slums, because that is something that we also work on. And where I was also wondering, you were talking about the shared enemy, COVID, for example, as a form of solidarity. What would you do? It's a thought experiment, I know. You work on the European cities, but how do you build then from the local? Is it also about the now and the relational practice in these hypermobile, very difficult circumstances of informal cities in global mega cities, let's say? Just to, or is it something to think about maybe?
No, it's of course it's a very different context, because I think, but I'm sort of having to stretch the limits of my expertise here. So please counter my arguments if they don't make sense. I think what is very important is that this question of solidarity and diversity is a specifically Western question, because it is related to the way we have been organizing solidarity in national welfare states. You have to remember that initially, in the late 19th century, the social movements proposing this kind of solidarity system were internationalist movements. I mean, the socialist movement, the anarchist movement, that were sort of struggling to have more solidarity, they were internationalist movements. And somewhere along the course of the 20th century, first of the 20th century, they have become national movements. They have established a kind of what we call in the social sciences methodological nationalism. They frame every question as a national question. And that has led to a very particular form of solidarity. I think if you look at cities outside of outside of Europe, you will have particular challenges which probably have to do with failed nation state formation, many of these countries, of imposed nation state formation because of colonial exercises. And that's a different legacy to deal with. So I do think in these countries, you have a different legacy to deal with, but I think you have to look at the history. So how did we create solidarity in the past? And what does that mean for how we deal with diversity? And in Europe, I think the welfare state tradition is incredibly important. And that's also something that social policymakers are not properly taking into account, I think. I think you will have similar questions in many
It's a big question,
yeah.
Because indeed, universal health coverage, we're now looking to sustain, to strengthen social protection in countries that. So that is a very interesting question, I think. And I just want to, sorry that I interrupt, to add some, because there are some remarks still from an anonymous attendee, which are quite big. What's your stance on BLM? What BLM, or Black Lives Matter, is pleading for: solidarity in a society mainly ruled by white people. And another one, cultural diversity is framed as a threat or challenge for solidarity. Is it related to a particular vision of Western governments, how migration is managed? I think that is answered by you about assimilationism. But the last question, Black Lives Matter.
It's a lot of big questions, so I
try
to do justice to them in the few remaining minutes. I think they actually found out that I think on the long term, we will need to deal with our colonial history, because it's very clear that a lot of one of the things we notice in cities is that poverty and inequalities are increasingly operating along ethnic and cultural lines or racial lines. So we see an increasingly overlap between ethnic and cultural minorities and the poor groups and the poverty statistics. So that basically means that there's a history to that, I think. It's not something that we can just explain from the institutions that are today. And so Black Lives Matter and similar anti-racist movements have a good argument when they say we should deal with that historical legacy. The problem then is, in terms of solidarity, is that will create division. I mean, these are difficult topics to deal with. So that will create divisions. But at the same time, you also have to create your society together. You can't wait until we've solved these issues over many decades before to create solidarity. So in that sense, I think this is a debate to be had. And I think this is something we should take very seriously also as welfare state scholars. But it's a debate which will initially be quite divisive and difficult to deal with. I mean, to what extent are our welfare states funded by by the resources of colonial empires? This is a difficult question, not being properly addressed right now, and then quite, yeah. A lot of the initial social policy scholars were part of the eugenistic movement, and that's a legacy that social policy scholars haven't really been dealing with. So there's a lot of discussion to be had, but initially they will be divisive. And so the question then is, how can we balance this kind of divisive debate, which we need to have in the long term, and we should take a long time to sort of settle, with the need on the medium and short term to create solidarity in our societies. And then again, we go back to this local level. I think there's a lot of things we can do on the local level to recreate that solidarity. And this is a bit of a thought experiment. We don't have any sort of very sound evidence to prove that. But the welfare state is actually a nationalization of a lot of small local initiatives, local housing, social housing corporations, local mutuals, local strike, how do you call it, strike, this kind of pots of money that were used to support strikes and so on. So the national welfare state was initially a lot of local initiatives which have been systematized around the Second World War in a national system. And so the kind of analogy that we try to make, but it's not, it's an analogy, it's a thought experiment, is that in fact, maybe we should reconstruct welfare states to be able to deal with diversity by again looking back at local initiatives. Perhaps on the local level, we can work in a little bit more pragmatic way out of a shared responsibility for the places, the neighborhoods that we share, and maybe we can experiment there with local initiatives, recreate solidarity on the ground where people are, where people do things together, where people work in a pragmatic way, and then sort of rebuild sort of more diversity encompassing solidarity system from the ground up. So
thank you. I think we're running out of time. I see that our moderator or IT man is saying that I have to stop. So I think it has yielded huge, interesting ideas. And I will also send you an overview of all other questions and ideas that have come up. Normally you hear the people themselves, but this was not possible for some reason today. But I hope you had fun with us, and you'll get an overview of all the questions to think about and so on. And thank you very much. It was very interesting.
If there are more questions, you can find my email.
That's true.
Google,
everybody
so please
can
feel free.
Also.
I would be very happy to engage in debate with you.
Thank you very much, Stein. Also on my behalf, I think it's very important to have this social perspective involved, because it matters a lot for the health systems and other work that we're doing. So to be continued our exchange. Lastly, I would like to guide you to our next webinar, which is being portrayed here. It's with Professor Meryl Singer from the University of Connecticut, which will talk about syndemics, which is particularly important given its relation with COVID-19 and comorbidities and the environment, including also the social environment, I would say. The date is still to be confirmed, depending on availability of the speaker. In any case, do reach out. You can find us on the website of ITM. You can reach our group, and we're looking very much to a next event. Thank you very much. Wish you all a good afternoon.